everybody to the NEMSIS training for November 4th, 2025. The title today is the extended data definitions for ePatient.14, race and documentation and best practices. Today we are joined by Randall Eimerman, who also was kind enough to do the training for last month. So welcome to the Randall Show. But joining him today is going to be our good friend Peter Brody, the New York State data manager, and they will be co-presenting this presentation. As always, we have the Q&A section open. So if you have a question or a comment that you want to have addressed during the presentation, please make it in the question and answer window, or kindly raise your hand. Use the Zoom tools to raise your hand, and we will individually unmute you so that you can ask your question during the presentation today. Also, if you want to be notified about this and many other events going on in the NEMSIS TAC, please make sure that you are subscribed to our listserv. To get onto that listserv, if you go to the NEMSIS website, nemsis.org, go to the very bottom of the page, and there is a link at the bottom to open a help desk ticket. Just say you would like to be added to our mailing list, and and if there's any relevant like sort of topics that you're interested in, we'll make sure you get onto those emails. So that's enough of that and enough from me. I'd like to hand the time over to Randall and Peter. Go ahead and take it away.
All right. Thank you very much, Chris. Like Chris had mentioned, today's training will be on the extended data definitions of ePatient.14, which is the race. And it'll be documentation best practices. Like I mentioned before, I'm Randall Eimerman, NESEMSO's NEMSIS liaison. I also offer support to the NESEMSO Data Managers Council. We also have today with us is Peter Brody. He's the the New York State data manager, but also very passionate about the subject here. So as soon as he found this training was happening, he was more than happy to sort of jump in with me and provide me with some additional materials. Today's training agenda will be very short and sweet. We're going to kind of be reviewing the ePatient.14, the definition and the source of that, where those items came from. We'll also be talking about the field values, the code list, and the items that were added, pertinent negatives that were also added into this version, and then lastly, we will discuss the extended data definitions. So first, in March of 2024, the Office of Management and Budget released new guidance on patients' race. If you follow the QR code, it will take you directly to the Federal Registry website. You can then search for OMB 2023-0001, and that will give you the complete document on the changes and all the opinions that were provided in this notice. Another highlight to today's training is about Personnel 13. Just wanted to add that this is about the EMS clinician or the EMS personnel's race. It is from the same definition source, but we've also added the same field value there of Middle Eastern or North African. So it'll actually be for both data elements today. And then there's always the question about the, collecting the minimum categories is what NEMSIS is doing here with their code list selection. And sometimes there's a question about how easy should we be asking this question? And the question directly from OMB states that what is your race and or ethnicity, making it a single question where they can select all that apply. This data element is one to many, and the patient may fall into multiple race categories, and that's why it's able to be selected that way. Looking here at the field value or the code list, we can see that we have American Indian or Alaskan Native, Asian, Black or African American, Hispanic or Latino, Native Hawaiian or other Pacific Islander, white, and then the addition here is the Middle Eastern or North African. Wherever possible, race and or ethnicity data should be collected through self-reporting, where the respondent directly provides their own race and or ethnicity. Where self-report is not possible, data may be collected by proxy reporting, where a person knowledgeable of another's race or ethnicity responds on their behalf. Another method is by observer identification, where an observer uses their best judgment of the most appropriate race and or ethnicity categories in which to report individuals. The final method really could be done by record matching, where existing records on an individual contain their race and or ethnicity and are used to supply that sort of information. That last one might possibly be a little bit harder on a 911 call, but it is also possible anytime you want to be able to do some record matching. So next, I'm going to turn it over here to Peter Brody. He's going to review the pertinent negatives that we have. And go ahead, Peter, whenever you're ready.
Thank you, Randall. In some scenarios, obtaining the information is not exactly easy, or it may not be possible based on the situation. And this can apply in both urban and rural environments. So there are some environments where, you may ask the patient the simple question that the Office of Management of the Budget suggests, and they absolutely refuse to provide the answer. And by refusing to provide the answer, you don't have a valid response to be able to put in, and the patient is the best representative. So you can click on that refused button, or the refused value. Unresponsive, we worked on a definition for that says an unresponsive patient without family, friends, or acquaintances around may not be readily identifiable as being of a particular race as defined in the national standard. You may run into a patient, in public settings, public environments, new person who lives in a new home. You may find them in an environment where they don't know, but your patient is unresponsive. The information is not obtainable that way. Unable to complete, we worked on the definition for an infirm patient, or a patient who, thinks that, Dwight Eisenhower is still the president of the country. I picked someone who looks like Randall for this particular point, but someone, who's not able to answer that question from their own background, and they're not prepared, or don't have the capability of answering the question. Sometimes there are individuals who are not able to answer questions at all, whether they're at supportive housing or group homes, and they don't have the information. Unable to complete is, you may have a patient who's responsive in some regard, but not necessarily to be able to answer that question. So we came up with those three so that if you don't have a valid answer for it, this gives you the opportunity to document much more consistently and accurately. Next slide, Randall. So for the extended definitions, some of these definitions in the changes that were just made, removed some terms from it. So Black or African American, they removed the word Negro, Asian, Far East. So Asia is a very large continent. Native Hawaiian or Pacific Islander, they removed the word other for Pacific Islands. American Indian or Alaska Native, removed the part who maintains tribal affiliation or community attachment. That is no longer a requirement here. And white, the Middle East or North Africa, removed those because they opened up the new code for that for Northern Africa and the Middle East. So moving forward, you see here they have some excellent definitions here where Asians are individuals with origins in any of the original peoples of Central or East Asia, Southeast Asia, or South Asia, including, for example, Chinese, Asian Indian, Filipino, Vietnamese, Korean, or Japanese. As I mentioned before, Asia is a very large continent. So, they made that a little broader. Black or African American individuals with origins in any of the Black racial groups of Africa, including, for example, African American, Jamaican, Haitian, Nigerian, Ethiopian, and Somali. And then Hispanic or Latino, you might remember eons ago, this was part of ethnicity. It includes individuals of Mexican, Puerto Rican, Salvadoran, Cuban, Dominican, Guatemalan, and other Central or South American or Spanish culture or origin. When you're looking at these values, you should select at least one additional value where appropriate. Next slide, Randall. Middle Eastern or North African. individuals with origins in any of the original peoples of the Middle East or North Africa, including Lebanese, Iranian, Egyptian, Syrian, Iraqi, and Israeli. So, and then Native Hawaiian or other Pacific Islander, individuals with origins in any of the original peoples of Hawaii, Guam, Samoa, or other Pacific Islands, including, for example, Native Hawaiian, Samoan, Chamorro, Tongan, Fijian, and Marshallese. And yes, that's a lot to pronounce all at once. And white individuals with origins in any of the original peoples of Europe, including English, German, Irish, Italian, Polish, and Scottish. It's important to be able to look at these and to understand. If you have questions, about where someone might fall within these categories in the back of the ambulance, the intent is to be as accurate and honest as you can, but be able to document so that we're able to assess how we're doing providing services to people of all backgrounds. Randall?
Thank you very much for that, Peter. And so really our last slide is just to sort of provide an update on this extended data definitions. Version 3.5.1 is currently in progress and being completed now. We have already updated the definitions in the document, but it has not been posted to the website as we have a few other data elements that we are still adding, and we're doing some cleanup from the last version. And then lastly here was just a QR code for the NEMSIS help desk, or you can go to nemsis.org like Chris had mentioned if you have any questions, needed help obtaining any of these documents, or would just like a copy of this PowerPoint, we'd be more than happy to provide it for you. So like I said, very short training today. We're here to take any questions if you have any while we're still here though. Chris, looks like Sundown does have a question for us.
There you go. He should be able to unmute now.
Yes, are you all able to hear me all right?
We can.
Okay, so I appreciate the training, and I very much appreciate the clarification on the method of data collection and the best practices for data collection, especially the emphasis on self-reporting. I think that there are a number of issues that are remaining that are not strictly not specific to the healthcare environment, but also just in the general practice of trying to get this data in any type of government document. One of the big ones to me is the increasing population of our patients that identify as more than one race, which sometimes can be very context specific. But aside from getting into the complexities, I guess the biggest thing I would want to ask about this is, in what universe do you think that field providers as a whole are actually presenting this to their patients as a question? I mean, or would even necessarily have ever been aware that this was the best practice to present this as just a general survey question to their patients when they're doing data collection, as opposed to what I would say probably better than 99% of providers do, which is to basically make an observer-based judgment on what they think the patient's appearance suggests their race is. I mean, do you guys think that providers are actually asking this question?
I can't speak to if I know that any providers are asking this question. I can speak as myself as a provider that it is a question that I would be asking someone, no different than someone's age, their first name, their last name, or any part of their medical history. These are recommendations that are being given out by the Office of Management and Budget on how to actually approach that question to make sure that you're getting the most accurate data collection possible. During the observer selection, you may not know to select multiple races for that field. So the idea of the training was to sort of set forth and to provide that OMB document so that internal work could be done to sort of facilitate that question and data collection better.
And to add to that, Randall, if you don't mind, I can
Absolutely.
tell you that in New York, we've had this field required since 2021. And that was a look on our side from the state side, and we've done a lot of training across our state on how to ask this question and challenging questions, in some of the environments. Because, in New York City being a very culturally diverse region, area of our state and of the country, the question popped up is, how do you ask this question? So we put some training together that we did out in the field for EMS providers, and we also when we started teaching documentation as an extra class in the EMT class, is included in it with how to ask challenging questions and what the value of the fields are. We recognize that changing the culture of asking a question like this is not something that's going to happen overnight, but it's something that we worked with our EMS agencies and our regions to be able to implement that.
Did that answer your question, Sundown? If you had more, Sundown, go ahead.
No, sorry. No, out of reflex, I went ahead and muted myself. But I didn't realize that I'd have to ask again. So it is an answer to my question, and I'm glad to hear that in New York that's been that this has been considered and it's been adopted as a method of education. I guess I'd just like to present the perspective, and I'm making assumptions here. I'm generalizing from my own experience as a provider and from my experience as an EMS educator over the last decade, and then also as being on the data side. And I'll just let me just share also. I mean, I kind of went on the same journey myself when I got into the data side, and I started looking at data definitions and trying to actually understand these questions, which I'd sort of been robotically asking over the, in the previous 10 years, and saying, oh, wow, here's this definition. And so actually looking at the OMB definitions and the best practices in OMB was a real eye opener to me. That's kind of how I sort of got, I kind of got the red pill on this particular thing in the first place. But what my experience suggests is that I think that this is extremely unnatural to the vast body of providers to even be thinking about this. Not just to say, oh, hey guys, here's this best practice from now on, but like to even have given thought to the idea that they should be approaching this aspect of a patient assessment other than just basically looking and say, oh yeah, that guy's black, this guy's Asian, this guy's Persian. I mean, that is, I'm positive that's how most providers are doing it now. And so I would say we can't underestimate how much actual work was probably going to be needed to really say that this best practice is a big thing. Like that's going to be a real surprise to a lot of people. So I would suggest, I guess my suggestion would be, I think that this needs to be publicized more. And I would go one step further, and then I'll shut up, which is the method of data collection. I'm going to go ahead and open up a ticket on the NEMSIS help desk, because I think that basically this question needs a twinned question. The method of data collection, whether it's based on self-reporting, record matching, observation, or proxy, like that should be a question that accompanies the ePatient.14. And I would say I would probably make it a nationally required question. I would go that far in order to, I think that that's actually going to start getting much better data collection. All right, thanks.
If you were just sort of mentioning adding those additional attributes there to the question, if you wanted to save yourself an NEMSIS help desk ticket, that process is already in place with the NESMSO's Data Manager Council, and we've communicated this request to NEMSIS already.
Awesome.
Thank you for all of that, Sundown.
All right, I appreciate it.
Any other questions or comments for today?
Hey, Randall, you've got one question from Karin, and I'm going to put the answer live. So if you look in the answered tab, you can read it from there.
That looks like a question for Peter. and how well the training went in New York.
I thought you might see it that way. I will tell you, it wasn't all ducks and roses in New York. As I mentioned, the culture change is not necessarily easy, but we continue with the training. And Karen raises a good point here. It's an ongoing effort, Karen. I mean, there were some challenges and obstacles, but we talked about different cultures, different environments, and that. And if you'd like, at some point, you and I can meet up, and we can talk about how I actually present that. I can find the PowerPoint and the presentation that we used to do that with. Happy to share that.
All right. Anything else, Chris?
Karen just put a response, said wonderful. That would be great, Peter. I don't see any other questions or hands up. Give it another like 10 seconds here. See if anybody else wants to get a last question in. But barring that, I think we will call this finished. Thank you. Oops. Have my camera on. Awesome. Thank you. Thank you, Peter and Randall, for taking the time today and presenting this topic. This training, as well as all of the previous trainings, are always available on our YouTube channel and on the NEMSIS website. If you are, again, if you're interested in getting notifications about this and from other events that the NEMSIS TAC is presenting, if you'll get onto our mailing list, if you go to the homepage and put in a help desk ticket and say you want to be added to our listserv. Also, I'd like to put in a little bit of plug for our social media channels. If you on pretty much any popular social media channel that you want to look for NEMSIS TAC, and you will be also apprised of other things and announcements that are coming out from the NEMSIS TAC. Other than that, I hope everybody gets a chance to vote today. It is voting day, so I hope everyone gets a chance to go out and do that today. Other than that, once again, if I can get a big virtual round of applause for Peter and Randall, thank you so much for the presentation today, and I hope everyone has a great, wonderful rest of their day.